Yesterday, I met for the second time with families of Israeli hostages being held in Gaza. I heard and felt their pain and heartache. WHO continues to call for the hostages to be released unharmed and without any condition. We're deeply concerned for their health and well-being, just as we are concerned for the health and well-being of the people of Gaza, which is becoming more precarious every hour. For the past 3 days, WHO has not received updates on the number of deaths or injuries in Gaza, which makes it harder for us to evaluate the functioning of the health system. What we know is that only 1/4 of Gaza's hospitals are still functioning. 26 out of 36 hospitals are now closed, either due to damage, attacks, or because they have run out of fuel. Patients, health workers, and ambulances are not able to enter or exit some hospitals. Prior to the conflict, there were around 3,500 hospital beds across Gaza. Today, there are an estimated 1,400, and there are many more patients than beds. Doctors and nurses are having to make impossible decisions on who lives and who dies.
What we have been informed is that 34 premature children are still alive, as per latest reports, and there were 39 to begin with. We were informed that 82 bodies were buried in a mass grave today. Remaining 80 dead bodies remain unburied. We got informed that hemodialysis is done for 45 patients for 2 hours only, that there is no central oxygen, water, power, and fuel. We are informed that there are 633 patients, 116 doctors, and a total medical, which includes a total medical and admin staff of 500. And also there's an estimation that there are still around 3,000 to 4,000 IDPs, that might be less.
Israel's military incursion into Al-Shifa hospital in Gaza City is totally unacceptable. Hospitals are not battlegrounds. We're extremely worried for the safety of staff and patients. Protecting them is paramount. WHO has lost contact with health workers at Al-Shifa Hospital. But one thing is clear. Under international humanitarian law, health facilities, health workers, ambulances, and patients must be safeguarded and protected against all acts of war. Not only that, they must be actively protected during military planning. Even if health facilities are used for military purposes, the principles of distinction, precaution, and proportionality always apply. The safety of patients and staff, as well as the integrity of the healthcare systems in the wider community, are of paramount concern. International humanitarian law must be respected.
International humanitarian law is clear. Healthcare facilities should not be attacked or used to commit acts harmful to the enemy. But even if they are used for military purposes, healthcare facilities are never without protection under humanitarian law. The principles of precaution, of distinction, and of proportionality always apply.
The most pressing needs are for a ceasefire, the sustained opening of the Rafah crossing, safe movement for humanitarian aid and workers, and for supplies of electricity and fuel to be restored. Electricity is needed to power the desalination and sewage treatment plants, hospitals, and telecommunications, and fuel is needed to distribute aid. We might be able to get aid into Gaza through the Rafah crossing. But without fuel, we cannot get it to where it needs to go.